I'm your host, Marsha Florence for Just Ask. Today's show, ladies and gentlemen, is Navigating Your Financial Security. Hurry back and join us. Hi, I'm your host, Marsha Florence for Just Ask. Today's show, ladies and gentlemen, is Navigating Your Financial Security, and we have two wonderful returning guests with us. John Becker, President of Advocate Financial Life and Health Brokerage, and Rodney Ross of Ross Insurance Group Advantage. Good afternoon, gentlemen.
It's great to be here, Marsha.
Well, thank you. Now, let me first say this. You know what? You guys come and see us quarterly, so this is our quarterly year meeting. All right? Okay.
That's right.
Okay. Well, you know what? It's that time of the year where everybody's always concerned about their insurances and what they should be doing to make sure that they got the right coverage. So let's go right into it today and talk about insurances and what people should be doing for their benefits.
And this is the time right now that everybody in America needs to look at their Medicare. You know, a lot of changes. Unfortunately, a lot of plans, Marsha, they're losing benefits. They're taking things away. Some plans have more dental. Some plans have less dental. Some plans will save you money in prescriptions. And the best part about working with Rodney Ross, who works with my firm, is that he can save you money and make sure your questions are answered and make sure you get the right plan. Because if you get the right plan, you're going to live healthier, Marsha. That's the best part about this season. But you need to sit down with a professional. That's why we're here.
All right. Now, last time you guys were here, you had a plan, the RSSA. You guys got to tell us about the RSSA. I know we talked about it last time, but let's refresh. What is the RSSA?
So, Marsha, the RSSA program, that is our Registered Social Security Analyst program. And that's a program where there's a designation, it's a national designation, followed by a intense 4-hour test that we go through to learn about how to navigate and how to work the Social Security system. What we do, we provide people that call us, our clients and our prospects, with answers to the two most important questions, which is how do I get my Medicare and how and when do I understand Social Security? That is a system that is just has a lot of moving parts, and the Social Security Administration, they are not allowed to even answer questions for people or give people help, shall we say. If you called and ask a question, they can give you a direct, specific answer, and they can direct you to one of the 2,000 forms on their site.
Correct.
And tell you, here, go find form SS blah, blah, blah. Now, our team, our trained team, what we do, we are able to take people and really walk with them and hold them by the hand to help them understand how to make the decision about Social Security, what their options are, the best time, because it's really a personal decision. It's a personal thing. And we help people by understanding what their goals are, what their plans are, and what they have already put in place. The average American, if they make the wrong decision about when to claim their Social Security benefits or what benefits to claim, that could cost them well over $100,000 in lost money opportunity.
That's a lot. That's a lot going on.
That's a whole lot.
It truly is. Now, I got to ask this question. So with this government shutdown in effect right now, does this affect you guys' ability to work with your clients?
It's really minimized because we're going to be out there and we're prepared to help anybody with the annual enrollment period. So one of the good benefits that we provide is we'll sit down with everyone and navigate them through Medicare and also navigate them through the benefits of Social Security. The government shut down, even though it's not the best thing to happen right now, but for Medicare and the Medicare season, come to see us and we'll help you get the right plan.
Okay, so now we know it's open enrollment season, but is there any changes with Medicare going on right now? Any new options?
Yeah, nationwide, what is going on is carriers are striving to be more profitable because there was funding issues in the past couple of years. And now there's a catch up to try to get more money for Medicare. Because of that, the big thing that we're seeing, Rodney and I, is they're increasing out of pocket in some plans. Mm-hmm. Some plans are the same. Some plans are taking away dental benefits. Some plans are adding. And that's why it's really crucial to take a look at your plan and work with a professional that will make sure you get what you need. And many of us know what type of issues we're going to have, what surgeries we're going to be facing. Do you need cataract surgery? Some plans will save you $100 doing cataract surgery with this plan versus with another plan. So it's time to sit down, sit down with a professional. Mm-hmm. And by doing that, it's going to save you money.
I think the biggest fear, though, gentlemen, is that a person is used to their physician, and they don't know if their physician is in that package. You know, does that physician covered? And so if they don't want to change because they're afraid that, oh, my doctor is not under in this group plan, what do I do? And they will stay somewhere just because of their doctor.
So, Marsha, and this point just alludes back to what John says about you need to get with professionals. And 800 numbers that call people, not to say they're not professionals, but they are working for a company and they are just trying to hit a quota for that company. They really don't care about or have any skin in the game for the person that they're working with or talking to. Our team, we are hands-on. Mm-hmm. We meet with people at their dinner table. We talk to people and we walk them through the Medicare requirements, which say, I need to verify that your doctors are in network. Our team, we work and we write business for 10 different companies here in Michigan. Here's what that means. We don't just tell you about one plan that you got right now. We can talk to you about what are your real options. We understand what your needs are. For example, do you need transportation to and from your medical appointments? Mm-hmm. Yes. We know how to find plans that include transportation. And what we do better than anyone else is we listen. We listen to the people that are talking to us. We understand what their needs are. Yes. So we help them find the correct, best package for them. And we don't tell them, we don't say, Mike, this is the package for you. We say, Mike, here are two plans. Let's discuss these two plans. Okay. So Mike has a chance to mm-hmm. understand what the options are, how they work, and which one works best for Mike specifically.
And one of the things that we do, Marsha, is we always look at who is serving their medical needs, who their doctors are, mm-hmm. who their specialists are, and also what prescriptions they're taking. That's one of the fundamental foundations, what we do in helping people with Medicare. And then we compare the plans. Rodney and Advocate has a platform that compares all the plans and makes sure their doctors are a network. Okay. Also, for many of us, our doctors are retiring. Mm-hmm. We can help you find the right doctor with the right ratings, with the right specialty in your neighborhood for you. And that's a real valuable service.
Okay. Well, I tell you what, we're going to take a break. And ladies and gentlemen, we'll be right back with some more good information because you need it. We'll be right back.
This isn't a workout video. It's about how LLS has helped blood cancer patients like me thrive and how your donation can help countless others. Please give today at lls.org.
And welcome back to the show. Now, ladies and gentlemen, if you're just tuning in, you know I always tell you get your pen and paper out, okay? So you're going to see numbers on the screen. These gentlemen are going to give you some information. And it's important because right in the midst of open enrollment, a lot of you are confused about how to maintain your physicians or when to change physicians, and if you have to change, why, and then what's covered. So the president himself and, well, both of these gentlemen are high up in their positions to help us understand clearly what to do in the process of preparing for open enrollment, your changing of your insurances. I myself am even confused, so hearing them today is a plus for me because I got questions. So I wanted to go back to both of you about, when a physician is not in the network and somebody needs to have a doctor visit or something or have surgery, they get upset. Well, that's not my physician and that person's not in the network and I got a bill. How do we control the choices that we want for ourselves instead of somebody just setting it up saying, well, this is the best insurance for you, and they don't know that that physician is not involved?
So, Marcia, your listeners, they have to understand finding a team of people, a company, an organization that serves as an advocate for them, that works for them, not the insurance companies, that is step number one. Now, if in fact you just want to talk to people on the 800 number, strangers that you don't know, you really can expect to get what you get because you don't know who you're talking to, you don't know what they're talking about, and they just know do something to you, sign you up. As advocates, we are your go-to person. We provide constant service. You reach out to us, you have our phone number. We are accountable to our clients and our family that we work with.
Okay.
So the first step is call us. Call the advocates that you can trust, that are in your community, that are there to serve you. That's step number one. We know what the rules are. We know how to help navigate finding the providers, how to work out your prescription medications. We also know how to help give information. There are people that have very expensive medications, and it's not unusual for companies either to not cover them or they have a copay that is exceptionally high. We know how to work with people to go to the manufacturer's website to find patient assistance programs for people who have prescription medications that they cannot afford. Unfortunately, there are a whole lot of people that they have medications that they're not taking because they can't afford them.
Right.
Or they go to the pharmacist and they say, can you give me half of that pill because I can't afford the whole pill. That is just part of how we just help our clients, and we serve as advocates for them to help solve those sorts of problems and challenges.
That's great. That's great because some people are so busy relating to the fact that, oh, they send me a gift card every couple of months. Oh, I get, free transportation. Oh, they come out and visit my home for physical. Now, I'm not saying anything is wrong with those things, but when you actually need service, when you go into the hospital, some of that's not on there. Okay, some of that stuff that you're looking for, the coverage is not included, and you didn't know that because you picked the wrong one or you picked the one with the less services.
And that's accurate, yes. However, the biggest part of it is the person that you're talking to, they did not give you the book in front of you that showed the benefits that you get and how much it's going to cost you before they enrolled you into the plan.
Okay.
They did not educate you, which again is part of what we
do.
and our team do. We educate the people that we work with.
And one of the things we've done, Marcia, is our clients get bills from doctors and hospitals they don't have to pay. One example is one of the clients got a bill for $5,000 for a colonoscopy. In the plan, it's zero. And he almost paid the bill. And we stopped that. So one of the other things we provide is if you get questionable bills that you are really nervous about, we might be able to help you not pay it because you're not supposed to pay it. Because believe it or not, hospitals and doctors make mistakes and they might charge you more than they should.
Oh, yeah.
So that's the other thing we do. We save people money and we create sleep insurance by being involved with you.
That's great. That's great. Now, I heard one of you
One
mention.
point, Marcia, if you don't mind, one point. Medicare people, they get a whole lot of mail. They are deluged with mail, and they don't know what to do with it. Our clients, we train them. Don't throw everything away. Get a bag, a plastic bag for groceries. Get one for your Social Security mail, one for the mail from your insurance company, one for Medicare. And our team will go see that person once every 2 or 3 months. It will just go through the packets of mail for them. And because EOBs, explanation of benefits, that is how you understand you don't have to pay a bill. Because you get a bill from the provider, but you look at your explanation of benefits and it says, the doctor didn't bill correctly. Doctor, send the bill back in, you don't owe anything. But if
Correct.
you don't read your EOB,
Right.
you don't know, and you're writing a check to pay a bill
Right.
that you're not responsible for. That's just part of our advocacy where we go through the mail and we help people with their EOBs. We understand
Right.
how tedious that process is, but we know how to do it, and that's part of our service.
Well, I'm glad you mentioned that because I read mine. So whenever I get a bill and I'm like, they charging me for this, let me make a phone call. So I always try to make sure that I read it thoroughly to know that they didn't bill it properly, and so I'll ask them to put it back through, contact, the insurance and make sure that it's done. And if they say this is it, then I know if it's really my bill. But if, a person just look at the bill and say, oh, they charging me, and they get upset, they don't realize that might not be their bill after all. But, kind of scared themselves right into believing that that's their bill. So, and you guys are so thorough. I'm telling you, it's always a pleasure to have you come. But I had a question. So I do know that we had something about the retiree care. Okay, retire care. Now, Rodney, this is a lovely picture of you. So I wanted to share this information with our viewers about safe retirement planning, secure growth opportunities, Social Security maximization, Medicare maximization, 401 protection. So the question is, although it may seem clear, we may have some viewers who are asking, what do you mean by maximization?
So, Marsha, this here is the three-legged stool. When you're talking about retirement, it boils down to there's Medicare benefits, Social Security, and do you have retirement funds?
Oh, yeah.
Do you have a 401k? Do you have a pension? Do you have money in the bank? We help people navigate the idea or the process of how you go from an idea of wanting to retire to actually being able to. We work with the person to be sure that they select a Medicare plan that is the best plan for them. That's one leg of the stool. We also give consultation to people about Social Security, when they're eligible, what they're eligible for, and the best time to apply to get the amount of money that works best for them. Okay. Then the question of, do you have other money? Do you have 401k? Do you have a pension? If the answer is yes, is all that money in the stock market? If the answer is yes, it is, that means that your money is on the roller coaster. You're losing money day to day. You make some, you lose some. When you're age 30, you can lose some money. When you're age 55, do you really want to be losing money in the stock market? Probably not. So as an uninterested, unbiased team of people, we look at the numbers and we simply explain, here's some options. There are products called safe money products, safe money. That means you put money in, that's called your principal, and your principal does not go down. It will only go up or stay the same. Okay. So we train people and teach people about safe money products, and we teach them how to reposition their funds.
So that's maximization.
It is.
All right, now I want everybody, the reason we left the flyer on the screen, ladies and gentlemen, you see that QR code. So if you got questions, you can always go to the QR code. And you see the phone number. So if you need to call Rodney Ross himself and ask him about these services, then by all means, you need to go ahead and make that copy on your screen now. Or you can always give us a call. You know that, just ask. So Rodney, you did a wonderful explanation. We're going to go to a break. And ladies and gentlemen, we'll be right back with some more good information, navigating your financial security. We'll be right back.
If you store your guns properly,
I'll feel safer when I'm playing outside.
Safer when walking home.
And I won't have to tell my kids, this isn't a drill.
Never let your gun get into the wrong hands. Always lock it up.
And welcome back to the show, ladies and gentlemen. Now, you know what? Rodney Ross and John Becker has given you a wealth of information. I hope that you will take in consideration their information if you are a person in need of trying to figure out what your benefits should be for the years coming. Now, I want to make sure that our viewers know that you guys assist our special needs population. Is it the visually impaired and the hearing impaired?
Yeah. Both Rodney and I are American Medicare disabled advocates, and we help people who are vision impaired and also hearing impaired. We actually have Medicare advocate interpreters, deaf interpreters, and we even have a deaf person who's a Medicare advocate. And Rodney, you tell them about what you're doing with the vision impaired community.
Yeah. So our team, we actually have business cards and business literature that is in Braille. So persons that are visually challenged, they can actually get our card and read it. It is just such an awesome thing when you walk up and you get introduced to a person that's blind and you say, "Can I hand you my card?" And they're accustomed to people, business people, just giving them stuff like they can see it.
Right.
But when they get my card, they touch it and their fingers and they feel, oh my God, they start reading Rodney Ross,
Right.
Ross Insurance. And then they look up and it's just the most awesome thing.
It is. It is.
And
I
our
mean,
team is actually going to be at the National Federation for the Blind State Conference, October 31st of this year.
Great, great, great. Now, Rodney, this was a sample card, I know, and this is the card that you normally would have.
Yes.
This Braille.
That is correct.
Okay.
So that's our, on one side, it's, you can see it, but on the flip side, it is done in Braille. So a person that does read Braille,
That
they're
is
able
wonderful.
to, yes.
That
And
is wonderful.
here's why we did that intentionally, because most people many of the blind people, they have a family member or someone else that they rely upon. So to have a document that's completely in Braille, the blind person would know what it is, but the person that helps them would not know. So that's why we have two-sided for all of our materials.
Great, great, great. And a lot of people want to be, independent. So this gives a person a chance to stay and keep their independence, and that's wonderful. Now, I have a lot of stuff up here, but I wanted to share with our viewers, not only did we have the flyer up about retired care, but you guys have a notebook. So tell us about this notebook. I mean, this is a nice notebook here, and it's got a lot of stuff in here, so who wants to let us know?
Well, basically, the reason why we did this, Marcia, is we work with people about ready to retire, and we also work with people in their financial journey before they see God. And many times, family members don't know where to find things when your loved one passes on. So, when you lose your spouse, you can't find things. So we put together this notebook that will have all the insurance papers, all the retirement papers, insurance policies, annuities, also legal papers, funeral planning, all those things. And that's why Rodney and I are financial security navigators. We provide this at no cost, right, Rodney?
That's correct. Yes.
That's great. That's great.
And we actually sit down with the person and we help them to populate the information that's contained inside. What that does, that allows us to be able to sometimes have an aha moment in terms of, oh, I don't have any life insurance, or I only have a term policy and it's about to expire in 5 years. So we identify gaps by using the notebook.
Or they have the
This is
wrong
good.
beneficiaries. Their money, when they pass on, goes to the wrong person. That's a real serious issue. And if they have retirement funds, if you don't set it up right, it's going to be a huge tax time bomb.
Okay.
But the key reason why is everyone needs this to put in passwords, to put in information about their banking statements. Because when someone passes on, they lose the wisdom and where things are at. And it's really sad when someone passes on, they can't find the life insurance. They can't find where the retirement funds are. And the biggest scary part is one couple, when they were going through this, the wife didn't realize the husband had a pension that did not include her.
Okay.
So when he passes on, she's going to lose $2,500 a month.
Right.
And that opened her eyes that they needed to plan so that she wasn't lacking when he passes on.
Because I see in here it says family information, financial objectives, life insurance, retirement, and annuities. That's a lot. And legal. Security, banking information, funeral planning, health insurance. So these tabs are very important. And a lot of people, now I thought when you guys brought this notebook in, I said, why is it so big? Well, it goes to show you there's something that can go on each page, and if you have a family, it will fill up. So it's not impossible to fill this up.
And although it may look big, Marcia, it really isn't, because I've got people that they're on their second book.
Wow.
In terms of putting information in it, because many people don't have all this stuff at hand when they first get the book. And this is part of the engagement that we have with our clients, and it's ongoing engagement. So they get the book, it's filled up, we now give up another book. We don't sell the books. There's no cost to the people we work with for helping. So you very well can have 2 or 3 books as we help you fill it up, and you don't have to do it yourself. Overwhelming. Our team walks you through it. We provide the plastic sleeves for you to put the materials in. You're not punching holes into papers.
All right.
And we find gaps, in their total financial and personal picture. And also it helps them decide, what do I want to do with my money? I talked to one young lady, she's not so young, she's in her 70s, and she had no children. I said, where do you want your money to go to? Right now, you don't have a will. Who do you have? You have a sister? Do you want her to get everything? And she said, no, I don't want my sister to get everything. Well, you need a will to make sure it goes to your favorite charity, maybe your favorite niece or nephew. And you build a lifetime of assets. And even people with modest needs have things that they might want to pass on. And they might need different plans, like a funeral plan.
This is a good way to start.
It's a way to take care of your loved ones.
Okay.
And more and more, when we do things, we have to have passwords. It is really unfortunate when you cannot do things because you don't have the passwords.
That's right.
And that's one of the reasons why we need these notebooks.
And you know what's even the biggest stopper? Not the password, but the username.
Yes.
Because if you don't know the username, you
You're not
can't
getting
even
in.
get started.
Yeah.
So that's part of the information that goes in the family section.
Somebody came up with the idea of putting it on the computer, but they didn't realize that the computer can contain it, but no one else can get it.
There you go. You can't access it.
Right, we don't want to do that. Well, before we wrap up, gentlemen, we want to put that flyer up one more time on our screen and, encourage people to reach out to you guys for retired care. Confidence in retirement starts here. So, ladies and gentlemen, I believe, I don't know about you, but I believe for today's show, you want to get some information from John Becker and Rodney Ross, because why? You got questions, and by you having questions, this is the best time to start to ask them now while we're in the open enrollment period. So, gentlemen, will you come back and see us again?
We'd love to, because we like to be other people's advocates, and that's why we're here.
Okay.
You'll have us, we'll be back.
Okay, well, you know what? I'm so grateful to have you guys come back, and I look forward to you coming back again real soon.
Yeah, thank you, Marcia.
Thank you, Marcia.
All right. Well, ladies and gentlemen, you know who I am. I'm your host, Marcia Florence with Just Dance. And what do I always say? First of all, you can always give us a call if you'd like to, anybody in our show, if you got a question for them or you want to see them again, give us a call, 1-800-323-5336, or email me at marcia@justastalkshow.org. And I'm your host, Marcia Florence, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.